Welcome to our slideshow about STD Prevention Strategies. My name's Reza, and I'm going to be taking you through the first 5 of them. There are 3 main lesson objectives within this slideshow. Firstly, we have to identify STDs and common symptoms. Second, to determine hazards and causes. Third, to identify types of prevention methods. The purpose of this all is to learn ways to effectively slow the spread of STDs. Before we go deeper on this topic, what even are STDs? STDs are infections that spread from one person to the next during sex. The most common in the United States are HPV, chlamydia, trichomoniasis, gonorrhea, and genital herpes. Here we have a graph that shows a 4-year span of steady STD growth in the United States. This is due to unsafe sex practices. There are many ways to have increased risk of STDs. The most common are unprotected sex, having many sexual partners, and substance misuse. To this, the symptoms of STDs are painful or burning urination, unusual discharge from penis and odd-smelling vaginal discharge, and some people even get genital or oral sores. But some do not show symptoms, which means they can keep passing STDs unknowingly.
To help with prevention of STDs, there are a few strategies that will help with that. The first one is abstinence. The definition of abstinence is basically being in a relationship without no sex, so no sexual contact whatsoever. Next, the second one is vaccines. Third is having fewer sex partners and being in a mutual monogamy relationship. And the final one is the proper use of condoms. These are a type of condoms that are used to help prevention of STDs. The first one is male condoms, which help with prevention of HIV transmission to about 80 to 95%. There's also female condoms, as well as dental dams, which are also used for oral sex, as well as gloves. These 3 are the most effective ways to help stop STDs. For abstinence, it's the most reliable way to avoid infection. Condoms reduce the risk of infection, but still can't fully prevent it, while vaccines help prevent hepatitis B and HPV. Now let's recap. Which method is 100% effective at avoiding infection? Is it A, abstinence, B, male condoms, C, neither? It is 100% effective. Now, if you would have chose A, abstinence, then you would be correct. True or false? Having multiple partners increases the risk of infection. If you chose true, you'd be correct. Last question. True or false? Everyone with STD experiences symptoms. If you chose false, you'd be correct.